My name is Dr. McKnight. I'm an Orthopedic Surgery Resident, and this is a day in the life. It's a Saturday morning. This is a call day. So we're just driving to the hospital, and the goal is to see all my patients, have all my notes written before 7 a.m., at which point I will meet up with the call team and we'll kind of run the list, see what patients came in overnight, what surgeries have to be done, and then I'll head off to the operating room and pick up our pager. So I'll operate throughout the day and also see any consults that come into the emergency department. And then once the day is over, I stay overnight and I will finish my shift tomorrow morning at 7 a.m. It's about 7:30, just got done with rounding on all my patients, writing all my notes for the day. Now we're getting ready for our cases. We've got a patient that broke their femur, so their thigh bone. What we're gonna do is go in, put a long metal rod down the inside of the bone to just bring the bone pieces back together and keep the bone stable so they can start to walk on it. But first you need to scrub in. So to scrub, first you're gonna take your scrub brush, you're gonna get your hands, the brush, wet all the way up to your elbows. I typically turn the water off afterwards just to save it. Then you just start scrubbing. So you want to make sure you get every part of your hand at least 10 times. So that includes both sides of your fingers. Then you're going to flip it over, use the brush to actually get your fingernails. You know you're doing it long enough if everybody else that's scrubbing into the case is already done. So then once I got my hands done, I want to get my forearms, again going a couple inches above the elbow. So again, we're only sterile up to our elbows. I'm gonna rinse off my hands, keeping my fingers above my elbow. This way, any germs will drip down my arm and not towards my hands, which I want to keep sterile. Again, at this point, I'm trying hard not to touch anything. And now I'm ready for my case. So we finished our cases for the day. Typically that happens around 3-4 o'clock on a weekend. Just an example of the type of things that we do. You can see that this person had broken their femur right here and then a little bit of a fracture up there as well. So we take a long metal rod and we actually push it in from the hip and go down the bone after aligning the two different ends of the bone. And then we put these screws in going up into the femoral neck to keep the bones from rotating around the rod that we put in. And typically when patients come in with an injury like this, they go from not being able to walk to being able to walk on this the next day. For the rest of my shift, typically I'll be holding the pager, so any consults that come to the emergency departments, this is people that have infections of their extremities, have broken things, dislocated things, I'll go and see. Just an example, if we had a patient, they called me the ankle fracture dislocation, like you can see here. This is something that's going to need surgery at some point, but right now we can't just leave them like that because all their cartilage will die if it's just pressing on the bone. So I'll go down to the emergency department, see the patient, reduce the fracture, which means take that ugly image and make it look something a little bit more normal. Here's just an example. So you can see there's still a fracture here and a fracture here, but for the most part, the bones are well aligned and it looks more like a normal joint. So this patient would either be sent home to follow up for surgery in the future, or we'd admit them to the hospital to do surgery in the next 24 to 48 hours. And we'll typically get one consult like this per hour when we're on call. Why orthopedics? And I think for me, the big thing is that in ortho, you actually get to make patients better as opposed to other specialties where you temporize things. And actually, hang on one second. We're gonna have to call this page back. That was the ED. We have what we call a native hip dislocation. So we need to go down, see the patient, get some x-rays, get him sedated, and then we'll put the hip back in place.
Let me get it, let me put it down. One time for anybody out there following their dreams. Anybody in the city looking to jobs so they can get to bigger, better things. You can't see that I was at a put in every day and night. Go to every trick or right, go to every bit of main just to hit them with the fade. When I stick it to the people that told me that I couldn't. Yeah. After all of the years of young Mowgli wore a frown, I finally learned that it's okay that I'm not white or brown. And though the people looking sideways drive me.
This is the end of the call night or day at this point. It was a pretty busy night. Had a few distal radius fractures, a few ankle fracture dislocations, a bunch of long bone fractures, a couple hip fractures. So it was pretty busy. Now I just need to finish up some notes, and then I'm gonna get out of here and go home and go to sleep. That's it. It's the end of a call day. So that was a day in the life of an orthopedic resident on call. Hope you enjoyed it. If you have any questions, you hit me up on medschoolinsiders.com.
We gonna make it. I kept my soul no matter how hard that they try to take it. Ooh, we gonna make it. Ooh, we gonna make it. Got that and not by my side. Ain't no way that you can fade it. Listen, you can't hold me down. 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 You